everyone. This is Vicki Olson from Stratus Health. I'm a program manager at Stratus Health, and I'm joined today by Eric Zabel, who helped develop the VBP worksheet that we'll be going through. So I'd like to start with going over the objectives. So our focus today is going to be on the value-based purchasing worksheet. So we've updated it for fiscal year 2018, made some changes that we hope are helpful to you. And we're going to go through how you would fill that out yourself, what reports you need, as well as, what columns that you would fill out. And then also, as we're going through it, we'll talk about how the calculations work, kind of some special considerations about fiscal year 2018 and how you would identify then opportunities for yourself for this year as well as for future years. In addition to this, we're going to also go through and talk about the fiscal year 2017 reports as well as looking forward to fiscal year 2019. So for fiscal year 2018, so this is a screenshot of our fact sheet. So the fact sheet is on lsqin.org. You can see the link there. So I know many of you are familiar with this fact sheet, but very helpful to kind of understand all the details around value-based purchasing. It's pretty complicated. I actually use this sheet a lot myself just as a reference tool. So it at the beginning has some basic information about value-based purchasing, also the case eligibility criteria, and then it goes through year by year with pie charts and measures as to what what is specific to that particular year. So on the next slide, you'll see just kind of a screenshot of the fiscal year 2018. Obviously, you can't read this, too small to read, but it kind of gives you a visual of how it's set up for each year if you're not familiar with this fact sheet. So when we look at fiscal year 2018, you'll see in the pie chart that the percentages are now equal, and that seems to be kind of the standard going forward. So each of the four domains are 25%. And then on the fact sheet is listed kind of the measures. Pretty much for fiscal year 2018, everything stayed the same except that the CTM3, the care transitions measured, that dimension in HCAPS is new, not to the inpatient quality reporting program, but to value-based purchasing, it's new. And then the PCO1, the early elective delivery, moved from clinical care to the safety domain. So that was a measure previously, but now it's in a different section, a different domain of value-based purchasing. So we also included a link here to the Quality Reporting Center presentation. So this was back in February, but it's an overview of fiscal year 2018. So it's a good kind of summary presentation. If you're interested, there are a few of those slides I've actually included in this presentation, but we wanted to include that as a reference. So now we're going to go through the worksheet. Obviously, this is also too small for you to see, but kind of highlights here that it's broken into the four domains, so you can see clinical care, patient experience, safety, and efficiency. And then there's an opportunity for you to put in your baseline information, your performance period information, which we'll talk a little bit more in detail. And then the worksheet actually then calculates what your measure score would be and does a summary of your value-based purchasing score. So this is a proxy. You're going to be filling it out if you're interested in using this. Obviously, it's a voluntary resource for you. During the year, your final results won't come until next spring, so the information you'll be entering on a quarterly basis is kind of the most recent data, but not the final data. So it really won't be till next spring when you get the results. So it's a way for you to track your progress as you go through the year. The green cells are the cells that you will actually be entering information in. Because the baseline data, you receive that this spring, that's static, so you'll enter it once and you won't have to enter it again. But as I mentioned, you won't get your final results until next spring, so you'll be entering your quarterly data as you get it, just so you can see your progress and see what your current performance is on the different measures. So what's the purpose of using this worksheet, and why would you choose to do that? It's helpful for you to monitor your progress and see where you're at on those particular measures. Also identifying what the priorities are for improvement. And, as you got your fiscal year 2017 results, you probably got questions from your senior leadership as to, well, how are we doing on fiscal year 2018? So this is a way for you to be able to answer those questions and share what information you have to date. And then understanding the worksheet also helps you understand how the measure and the domain calculations work, as well as the overall value-based purchasing. It helps you understand kind of the differences between the achievement and improvement points, how you rank in terms of your current performance on those, and also what happens if you don't have enough cases to be eligible for a measure or for a domain, or and how that would get reallocated. So the first thing when you get the worksheet, so the worksheet, we provided both a template worksheet for you as well as two examples, a large PPS example, a smaller hospital example. If you did get the worksheets off the webinar site, we have made a minor change in the CDI, trying to put the correct achievement and benchmark thresholds. So the most current worksheet is actually on the LSQIN site. It's in the event, this event. So if you look in the event page and you look at, for today's event on September 14th, that's where you'll find them loaded. So when you open it up, first you'll get these messages, and so just accept these messages that you want to edit the workbook, you want to enable the content, and that this is a trusted document. When you open the worksheet, it's organized the way it has been in previous years, where there's three tabs. There's a tab for baseline instructions, so as you're entering that column in, there's specific instructions for you to refer back to, as well as the performance instructions for that column. And then the third tab is the actual worksheet. So there's a few things that you'll need before you can get started. So obviously you need that information for the baseline and performance period. So there's basically three reports. So the baseline report, you would download actually from QualityNet, run that report, and we'll have some screenshots to show you what that looks like. Then you need your inpatient preview report that you get quarterly, and that will give you your kind of quarterly updates as you build towards your final results next spring. And then for some reason, the Medicare spending per beneficiary, that is not on your inpatient preview report, so you will need the information off of that. And the latest one that you would have received would have been last May. So to access the baseline report, you would go to QualityNet, so you need to be a QualityNet user. You would choose Run Reports, and when you choose Run Reports, then you'll get different options. So you would pick the IQR program, and then the value-based purchasing feedback report, and then that will give you a couple options, and you will pick the baseline report. That percentage payment report that's right above it, that's what you would use to get your fiscal year 2017 results. But because we're really talking about fiscal year 2018, all you have at this point is your baseline report, because you won't get those results until next summer. And then this is kind of the header of what that will look like. It's a 4-page report, and we're going to be walking through, what that looks like as we talk about filling in the worksheet. So that's the first report you need, is your baseline report, and pretty much that's what you're going to use to fill out the baseline column. To access your inpatient quality reporting preview report, you do the same thing. You go under Run Reports, and then on the next slide, you'll see it'll be the Inpatient Quality Reporting Program. It'll be the preview reports. Now, the important thing here is these preview reports don't stay. So when you get notification, that the review and correction period is there and that these reports are online, you need to pay attention to those dates so that you can run it and download it so that you can save it and have it. Otherwise, it disappears, and then the next one, comes for the next quarter. And then you would choose the public reporting preview report. And then this is the header for that, what that would look like. And, this report is a 17-page report, so it has a lot of data in it. So good idea to have that one around since it's your most recent CMS data. And then the third report, the Medicare Spending per Beneficiary report, you would also go to QualityNet. I don't have a screenshot of that, but instead of doing the run reports, you go to the Secure File Exchange. So this is something that gets pushed to you that then you can download from that section of QualityNet. And as I said, the last one you would have would be from last May. So those are the 3 reports. That's all you need to be able to start filling in the worksheet. And so now I'm going to go through each of the different domains. So we'll start with clinical care domain. This is just a screenshot of what's in the fact sheet, so you can pull this also up in the fact sheet. But you'll see with clinical care, you need a minimum of 2 measures. So these are the mortality measures, AMI, heart failure, pneumonia. If for some reason you only qualified, had 25 cases for one of those, then you would not get a domain score. But most people have heart failure and pneumonia. AMI would be the one, that would be less frequent. So most people do have at least 2 of the 3 measures. And then, as I said, you need those 25 cases. So this is a screenshot of the baseline report. So on the first page are the 3 mortality measures. And you'll need to look at the first 2 columns. The first one is number of eligible discharges. So that's what's going to tell you if you had 25 cases or more. You can see in this case, AMI, there were only 9 eligible discharges, so that would be a case where you wouldn't get a measure score for that particular condition measure. And then the second column is the baseline period rate, and so that's the information that you're going to enter into the worksheet. So be aware that this is survival rate in the baseline report. And as we move into what you're going to enter for the performance period would be off your preview report, you notice this is not survival rate, but mortality rate. So the worksheet, as we get to that, you'll be able to see that it will actually do that calculation for you, so it's comparing apples to apples. But off the preview report, then you'll need the information. Once again, need to look at the number of eligible admissions so that you can see that you're over the 25 mark. In this case, AMI, that's not the case, and also it doesn't calculate a mortality rate. And then for heart failure and pneumonia, you have 71, 73 eligible discharges, and then you can see the 11.3 and 16.0 is what you're going to be entering into the worksheet. So as we look at the worksheet, what happens for the first one, AMI, you can see that the greater than or equal to 25, we've changed that yes to a no, so it defaults to yes. But you can, this is in a green area, so anything in green you can change. You would change that to no, so that the worksheet would know that you would not calculate that particular measure. And then the baseline information, this is one of the enhancements that Eric's done, is that you don't have to change the decimal points. So whatever is in the baseline report you would enter, and behind the scenes, the worksheet will change the decimal places so that it's comparing apples to apples. So, as I mentioned, for the baseline, you're going to enter in the green where it says, and that's the survival rate, but you'll see in the performance, you're entering into the mortality rate, and then the worksheet will calculate what the survival rate is. Then compare that against the benchmark and the threshold. And just as a reminder, the threshold is the 50th percentile of the baseline year. So taking all hospitals across the nation, the 50th percentile was the threshold, and then the benchmark is the mean of the top decile, or you can think of it as the 95th percentile. Also in the baseline year, so that's how CMS calculates that. So that information is in your worksheet and then used to do the calculations. So you can see for heart failure, this hospital would have gotten 2 points for reaching the achievement threshold, or getting towards the achievement, getting towards the benchmark, I should say, but above the achievement threshold. 2 points for improvement. So improvement is really comparing your performance to the baseline year and whether you've improved from the baseline year. And then you get whatever is the highest of those two scores for your measure points. So in this case, they were the same, so you got 2 points. For the pneumonia, ended up getting 0 points because it was below the achievement threshold, and there also wasn't improvement. So those get added together to be your overall points. You could have gotten 10 points for each of those measures, and so that's why your potential points is 20 in this case. Now, if you're qualified for all three measures, then it would be 30 points. But in this case, it was 20. And so your unweighted domain score then ends up that 2 divided by 20 to get 10 points. So that's your unweighted domain score. So that's what it looks like in one example. I'm going to just show you another example. This is a case where there were enough cases for all three measures, and so you can see in this case, this hospital performed well on AMI and got 7 points. Not so well on heart failure. Pneumonia was 1 improvement point, and so it got a total of 1 for a total of 8, and then 8 divided by 30 was then this 26.67. So that was the domain score for that particular hospital. So those are examples of what the clinical care would look like. Now we're going to move on to the patient experience domain. And as we shared, there's one new measure for value-based purchasing, and that's the care transitions measure. So this is just the information about the 3 questions off the survey that then roll up into that domain score that we thought we didn't include here. So the eligibility, requires 100 HCAP surveys. I've never seen a PPS hospital that didn't have at least 100, so it's pretty unusual to not get a domain score. And if you look at the baseline report, you would just enter that first column, the baseline period rate, and go right down the line in terms of entering it into the worksheet. Now, you wouldn't enter the percentage, you just enter the number. And then off the preview report, you just have to be careful about picking the right column. So for most of the dimensions, you're going to pick the percent always, and that's what you would enter. You have to be a little more careful about your order. And then when it comes to the next page, you'll see for a few of the measures, it varies a bit. So for the discharge information, you would be picking off the percent yes. For the care transition measure, it's percent strongly agree. And then for the overall rating of the hospital, it's percent 9 or 10 that you're using. So those are the boxes that you would use for the performance period. So when we see it all together, you'll see for this small PPS example, small hospital, the information has been entered, the baseline information has been entered into the left-hand column. You'll notice there's a couple NAs there in blue, and that's because in value-based purchasing, the cleanliness and quietness get put together into one measure, and so you'll see that just underneath the blue, you'll see the average of the cleanliness and quietness percent always that came off your baseline report. What happens when you get to your preview report is that it has those two separate questions. So the best we can do is just kind of average those two results that are in your preview report, and so you'll see in blue came up with an average of 70, taking those two measures for the individual questions. So that's the only kind of difference with the small PPS example. So there is some, one thing I will mention just and I'll kind of remind you also at the end of the presentation, but for the pain management measure, that's the one that CMS is part of the outpatient rule that's currently a proposal. They're proposing to temporarily remove that. I think there's some concern, although it's not substantiated, there's still enough concern about that impacting our whole opioid crisis, and so certainly don't want to incent providers to be doing something that might impact our overall performance and in addressing that concern. So they're thinking of temporarily removing this particular HCAHPS measure and then relooking at the measure or doing a little bit more research as to what the impact of that is. So it will probably be a temporary change. That isn't final yet, so that's something to watch for in the outpatient rule as that gets finalized this fall. So I think that's it on the worksheet part. I think there's a couple things that we get a lot of questions about, so just wanted to do a quick review. So consistency points is really rewarding hospitals to be doing well across all of the measures. So a hospital can get from 0 to 20 points for consistency points. And if all of their measures are greater than or equal to the achievement threshold, they will get 20 points. Now, if one of their measures, if any of their measures, is below the floor, which is the 0% in the baseline year, then they would get no points, consistency points. And then if they're somewhere in between, they, a hospital would get from 0 to 19 points. So People often have questions, so this gives you some language to be able to share that and also explain what the floor is, since that is, specific only to the experience domain. There's also another thing with the calculation that you'll need to be thoughtful about explaining to people is that now that we have added the care transitions measure, instead of 8 measures, there's 9 measures. So previously, the 8 measures, each of them, a hospital could get 10 points, so that would be 80 points, and then the consistency score was 20 points. So it totaled up to 100. Now there's 9 dimensions, and so in order to still meet that totaling up to 100, what CMS is doing is multiplying the 9 dimensions times 8/9, and then that will end up with giving you a total possible of 80 points, and then the 20 consistency points, so it will still add up to 100 points. What Eric's done is he's built that into the worksheet, so you don't have to do any of that calculation yourself. So when we look at another example, in this case, a larger hospital, you'll see in the yellow section, you'll be able to see both your unadjusted earned points, so that's taking a total of a max that you could get of 90, and then the next row then does that calculation of multiplying the first row times 8/9, and then you can see what the score is. So it'll be a little bit lower, in this case 21, and then in this case this hospital earned 18 consistency points, and so those get added together for a total of 39. And that is unweighted, so we'll talk about the weighting a little bit later. So that's the patient experience domain. And if you're still hanging in there with me, we'll move on to the safety domain. So the eligibility here is that there's a total of 3 measures that are required. So this is probably the domain where there's the most chance of not getting a domain score for some very small hospitals. The PSI 90, I've never seen a hospital that didn't meet this criteria, but there needs to be at least 3 cases in one of the indicators. So the PSI 90 is a composite, it has many indicators underneath it. So it only needs one of those indicators to have 3 cases to get a score. So that's, I think, pretty unusual to not have a score. What is more common is the NHSM, the infection measures, the HEI measures. You need to have at least 1 predicted infection to even get a measure score. So oftentimes for a smaller hospital, and also depending on the measure, that might be the case. So you'll see examples of that as we go work through this. So you're going to take your baseline report, and Eric's ordered this in the same order for the baseline. So you're just going to enter this data. So you'll see PSI 90. You're going to enter that index value. Then you're going to also enter in the number of predicted infections, and that will give the information to the worksheet of whether you meet the eligibility requirements of having 1 predicted infection. So you enter those in, and then if you have a SIR, a standardized infection ratio, for any of the measures, you would also then enter that in. And obviously, you're only going to get a score for the ones where you have a SIR. And then, as we mentioned, the PCO1 is new to the safety domain. You need 10 cases for the PCO1. So in this case, the denominator was 171, so you met those 10 cases. And then the baseline period for this hospital was 0. So that would be what would be entered into the baseline column. Then for the performance period, we go back to the preview report. Look at the PSI 90. Everybody will have an NA there, so you have to kind of ignore that. If you have a PSI 90 score, you have to assume that you met that eligibility criteria. So in this case, it's 0.89. Then for the other measures, then we're going to find the HAI measures on the preview report, and once again, look at that predicted infections, enter that information as well as your SIR for any of them. For this one, you do have to be more careful because it doesn't match the same order as the baseline report. So we ended up prioritizing the baseline report as Eric was building the worksheet. And then the last one then is the PCO1. So once again, you have to look at the number of patients, make sure it's over 10, and then enter in the 0 in this case. So we put it all together into the small PPS example, and you'll see there was really only 3 measures this hospital met, but that is the minimum, so they did get a domain score. So it's kind of hard to read. But in this case, it totaled up to 18 points, possible of 3 measures times 10, so possible of 30 points. And then this hospital, I think it's like 60%. Oh, 60% final? Okay. And you also, in your handouts, received the entire worksheet of the small PPS example and the large PPS example, so you can print those off too and look at those. They'll be a little bit bigger than what's on these slides. So you have that as a reference also. So that's one example. At the end, you're really getting your unweighted domain score of the safety domain. We look at another example, the large PPS example. In this case, there were a few more measures that were met. So 1, 2, 3, 4, 5 of them. So 5 of the 7. So a total possible of 50 points. In this case, the hospital got 26. And so that was a domain score of 52. I do want to highlight FSI because it's a little bit different, and it's also different than the HAC program in terms of the calculation. So what happens with the FSI is that you end up getting individual scores for the abdominal hysterectomy and the colon surgery. In this case, this hospital didn't meet the minimum criteria for the abdominal hysterectomy, just got a score for the colon surgery. So 100% of their FSI score would go to the colon surgery. So they got 0 for that, so they got 0 overall for their FSI. If they had gotten an abdominal hysterectomy score, then these are averaged, but based on the weighting of the predicted infections. So they're still, the overall score would get averaged between the two, but it would depend on how many predicted infections. So there is a weighting factor as part of that overall calculation. So that's a little bit different than the HAC program, so you might get different scores in those different programs. So the last domain, the efficiency and cost reduction domain, you need 25 cases. This is also a situation where I've never seen a hospital not have a Medicare spending per beneficiary result. But there is a requirement of having at least 25 cases. So we look at the baseline report. You'll see the ratio for the Medicare spending per beneficiary measure. The number of episodes were 125, which is greater than 25. So this would be the baseline results. Then for this one, for the performance period, you can't go back to the inpatient preview report because this data isn't on it. So you have to pull up your Medicare spending report, and this data is on 2 separate pages. I think it's page 5 or 6 or something. You'll see your overall ratio, the 0.84 result, and then you double check that you have enough eligible cases, which in this case was true. And so those get put together and entered into the baseline period and the performance period. Now, these cells that are colored blue are kind of proxy measures. If you remember, for Medicare spending, CMS does not give us targets. They actually calculate this benchmark and threshold based on the performance period, so you can't really anticipate it. What we did for the sake of kind of a proxy measure is use the information for 2016. So Eric has, identified the 50th percentile threshold and then the 95th percentile for benchmark, and put those in there. So you just need to, as you're sharing these results with your leadership, be aware that this is just an estimate, and that's, true, of course, for, across the board for using the worksheet. So on the next slide is just an example. When you get your Medicare spending per beneficiary report, it shares this overall data of how hospitals performed, and so you can see the distribution hasn't changed a whole lot, between 2014 and then our latest results being 2015, but that's the information that we use. So overall calculation. So now you have the unweighted domain scores for each of the 4 domains, and so now to get your total performance score, it's taking each of those. So just in the yellow is the unweighted domain score for each of the 4 domains, and then you can see the calculation for the total performance score. So it's pretty much taking those unweighted domains and multiplying them times 25%. CMS was made a little easier now that it's consistent, from the percentage weighting factor for each domain. And so you can see this adds up to 36.4175, or the worksheet brings it out to the second decimal place. So this hospital got 36.42 as an estimate. Now, unfortunately, it's not the same from year to year. The way the value-based purchasing program works is that 2% gets taken away from every hospital on paper and then gets redistributed based on performance. So part of the rule is that this is a budget-neutral program, so whatever gets taken away from hospitals gets redistributed from hospitals, so the government doesn't make any additional money. It's just more rewarding and incenting good performance. Because of that, it changes from year to year what the curve is. So 36.42 in one year might be really good, another year might not be so good. Just depends on how all the other hospitals perform. So you can't make any judgments about how much money this will impact your hospital, but you can at least know that the goal is 100, and so you can see where your opportunities are for improving. If for some reason you did not have a domain score in one of the domains, then that percentage gets redistributed. So in this case, you can see the big red axis on patient experience. That's probably rare that it would happen with patient experience. It'd be more often the safety domain. But if you did not have a domain score in one of the domains, then it gets redistributed to the other 3 domains. So you would still get a total performance score. So pretty complicated, a lot of information, but people have found, I think, the worksheet to be pretty simple to use, and certainly once you've gone through it once, it's much easier to use the next year. So we now have people who are looking forward to getting the next version so they can start looking at what their performance would be. Just going to spend a few minutes looking back to fiscal year 2017. You've already gotten those results, and then also looking forward to 2019. So these results you would have gotten at the end of July, and you would actually have to go on QualityNet. So when we were looking at that screenshot on QualityNet, it would be the value-based purchasing percentage summary report. So that's static, so that's always there, so you can pull that up if you haven't looked at it, and that will give you both your performance on all of the different measures as well as your payment and adjustments. Now, as we know, there were some changes with CDI along the way, so the final payment numbers usually come out in October. Sometimes there's slight adjustments as they realize, there's some things they need to address in the calculation. So we are up to 2% now, to the highest. So 2018 will be also at the 2%, but so was 2017. And as we were talking about this, value-based purchasing is different than the readmission reduction program and the HAC program incentive in that you can actually make money, you can earn more money based on your performance. So you can get additional monies, you could break even, or you could have a penalty and lose money based on that. So these are just some screenshots this is the information on how you would access your fiscal year 2017 results. So you can follow these instructions. Also, here's some screenshots of you would pick the run report. And then you would see on the next page, looks like it's cut off a little bit, but it says value-based purchasing, payment summary report. And it's the IQR program, and then the report category is hospital value-based purchasing feedback reports. So same place where you're going to get your baseline report. In terms of how you would read your 2017 report, there was also a presentation on that, so we put the link here in the Quality Reporting Center for that information. So that was on July 26th, they did a presentation. So you can access those slides if you're interested. There's also a document on QualityNet that summarizes how to read your payment summary report. So you can use that as a resource for you too. So our plan is to do the hospital comparison graph. So as part of the Lake Superior Quality Innovation Network, so Minnesota and Wisconsin and Michigan hospitals, we are going to be providing reports later this fall. So once we know that the data is final and stable in October, then we'll create the value-based purchasing comparison reports. These are by state, just helpful to compare your performance to other hospitals in your state, so your colleagues. And you can see both how you did on your total performance score as well as your domains, each domain and also each measure. So this is just a screenshot of what it looked like for fiscal year 2016. Of course, we'll be doing 2017 results. This was for Minnesota, and you can see the hospitals in the blue were the high performers, and they were some of them were above the Minnesota average, or certainly above the national average, and then we had some that were between the two, between the Minnesota and national average, and then some that were below the national average. So that's kind of the color coding for this. But as we said, it goes through each measure too, so it's a whole packet of different graphs that show how you compare within your state. So look forward to seeing that. And then as we look forward to 2019, so that will be next year's performance period, just thought we'd share with you, now that the inpatient rule is final, some plan changes for future years. So you can see the percentages are the same. They did change the name of the patient experience. You know, it's a pretty complicated name, so they've simplified it now to person and community engagement. But otherwise, the domains stay the same: clinical care, safety, and efficiency, and cost. And the measures that will be new in or different in 2019, the new measure is the complication rate for hip and knee. So that's a measure that's been part of the inpatient program. So you would have claims reports and information on that that you would have gotten in May that you might be interested in looking at how you're doing. One thing you'll notice throughout the presentation when we've been looking at the inpatient preview report, I've kind of grayed out the right-hand side that talks about comparison. And for those of you who I've met with, you'll know I consistently reinforce on some of these reports, CMS will say no different than national average or better than national average or worse than national average. And most hospitals, fit into the middle of no different. And unfortunately, that can give you a sense of, okay, I'm doing pretty good on this measure. And you really need to ignore those and not be sharing that information within your organization. Because when it comes to value-based purchasing, you're really compared on what the measure is, not on confidence intervals. And so you really, the small differences between hospitals make a difference in terms of your performance results. So we encourage people to not put a lot of emphasis on how you fit based on, national averages. So hip and knee will be the new measure. CLABSI and CAUTI now do include the non-ICU locations. So they waited a little bit longer with value-based purchasing because they wanted to make sure that you were comparing to the same data in the baseline year. So now with fiscal year 2019, generally, the performance year is 2 years back, so that's 2017, and the baseline year is 2015, which is when that standard population data was from. So those will be changes. And then the PSI 90, there is a comment in the final rule that came out in August that they proposed to remove that actually because of the change in that measure. So I think people are excited about the changes in PSI 90, but because they're substantial changes, it would be kind of considered a new measure. And as you may remember, for value-based purchasing, any measure that is included in value-based purchasing needs to be publicly reported for a year before it can become part of the program. So they're proposing that this would get removed in future rulemaking, but then eventually the modified PSI 90 would come back into value-based purchasing. And then, as I mentioned, HCAPS, the pain management might be temporarily removed, and that's a proposal at the moment as part of the outpatient rule. So those are potential changes for 2019, and for future years, we just listed the ones coming down the pike. So these would be ones that would be helpful to look at your results in the inpatient program, so you're getting current data on these, and start your improvement efforts so that you can be looking forward to your performance in these years. So more specific episode payments with EMI and heart failure, then a couple new Well, pneumonia is not new, but they've updated the cohort, and that expands actually the population by quite a bit. And then COPD would get added, as well as eventually cabbage. So, lots of information. We've got a few minutes for questions. Cheryl, could you open the line for any questions?
Thank you. We will now begin the question and answer session. If you have a question, please press star then 1 on your touch-tone phone. If you are using a speakerphone, you may need to pick up your handset first before pressing any numbers. Once again, if you would like to ask a question, please press star then 1 on your touch-tone phone. Standing by for questions.
Yeah, so there are some questions in chat, so I can address some of those. Can you confirm what ARC version will be used to calculate the PSI 90 for fiscal year 2018 calculations? I did have that, but I don't know if let's see. It might be, I think it's version, let's see. Please note so this is off one of the CMS memos. It would be the recalibrated 5.0.1 HRQ QI software version that would be used, it looks like. So 5.0.1.
We also have a question, how often are the preview reports updated in QualityNet?
So you do get those reports quarterly. Oftentimes they're a month or so after you submit the data. So like the August information, then, I think it's generally in September you get that information. Same for February, May, November. So you can watch for that. Copies of today's slides, those are on the lsqin.org website under this event. And as we mentioned, the updated version, so the version that is on the LSQIN site has the correction for CDI. On April 29th, CMS changed the CDI achievement threshold and benchmark slightly, and so we've incorporated that into the worksheet version that is on the lsqin.org site. So somebody's also asking a question about the MSPB report received in May is for 2015, and indeed that is the most current data that you have, so that's a good point. That ends up a proxy, kind of a proxy, because it's the only data that you have, but that for 2018 it will be actually your data that will come out next May that will be used for 2018. So it's kind of a good reminder that the information you're entering into the performance column really is just a guess as to what is the most recent data. It's not a final result. So any other questions in the queue?
At this time, I show no audio questions.
Okay. So we do have the slide up of who your state contacts are. So in Minnesota, it would be myself. In Michigan, Donna Madras, and in Wisconsin, Ross Gaske. So those are your contacts. If you have any questions, and they're very familiar with the worksheet. So as people are looking it through, particularly if you're using it for the first time, feel free to call and ask questions. If there's questions about the calculation, Eric Zabel in Minnesota created the worksheet, and so we can certainly give you that contact information, or you can contact one of us and we'll forward it to Eric. So if there aren't any other questions, I guess we'll end for today, and congratulations on all your hard work, and we're here to support you. We know it's a complicated program, and we certainly want you to be successful, so feel free to call us for support. And with that, Cheryl, I think we'll end the program.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for your participation. You may now disconnect.